Hey y'all, this is Tina with the Nurse Knows telling you about what I know today. I know that some of you probably don't watch the news, or if you do, you don't look for healthcare information. It's okay. I know that some of you depend on me to tell you what's latest and greatest in healthcare and what you should be aware of, and that's okay too. That's what I'm here for. I know some of you text me, you call me, or email me, and it's all good. So what I do want you to know is that the latest in healthcare is the concern for what they're calling now the Tridemic. You got it, 3 of them: COVID, the flu, and RSV. So we all know about COVID. I know we're sick and tired of it. We're sick and tired of being sick and tired, and so am I. We have the flu. Flu season has started. And it is what it is. That's been here for as long as I can remember. And then there's RSV that's affecting the respiratory systems of our children. RSV stands for respiratory syncytial virus. Look it up. And it attacks the respiratory system of children. So why am I bringing this up? To beware of your signs and your symptoms. I know it's very difficult right now to kind of tell what's what. I was a little nasally myself on yesterday and probably a little bit now. It's difficult to tell if you have seasonal allergies, if this is from seasonal allergies, or is this from, the weather changes, atmospheric pressure changes, because it's winter in the morning, it is spring mid-morning, it is summertime some days this week, early afternoon, then you get to fall about 6 o'clock and you're back at winter after 9 o'clock. So it's kind of difficult to tell if you're getting some things because of the seasonal changes, or if it's COVID signs and symptoms, or if it's the flu. You don't know if you're contagious or if it's not. So just be aware. For respiratory syncytial virus, RSV, please make sure you pay attention to your children. If they have what presents to be a cold, and it does not go away, does not improve, please contact their pediatrician and get them seen, because they may have RSV. The other reason I bring that up is once you are aware of your signs and symptoms, be sure to get the type of treatment you need for the situation. What am I saying? Stay out of the emergency room if it's not an emergency. There are a couple of reasons why. Why? Because the emergency room is already packed, window to wall. It is literally patients in the hallway for medical emergencies, for traumas, but also for COVID, flu, RSV. There are patients everywhere in the hospital. So one reason you don't want to be there is exposure. If you're there and you don't need to be there, there are other people there who do need to be there, who are legitimately sick and sometimes contagious. You don't want to put yourself in proximity or in harm's way if you can help it. So the hospital is one of the worst places that you could go to pick up something that you didn't come with, you take it home. Don't do that. So stay out of the hospital if you don't need it. Emergencies are for the emergency room. If it's not an emergency, contact your primary care provider or your urgent care. So the other reason is it saves you money. Groceries have skyrocketed, and other costs of other things skyrocketed. You go to the emergency room, you'll likely get a big old bill after you leave. If you go to your primary care provider, urgent care, $50 tops if you have some insurance, or what you're gonna pay is minimal compared to what you're gonna pay at the hospital, if you can afford to do that. I realize not everybody has insurance, so that's a different ball game, and I am not disqualifying your need to go to the emergency room. I'm not talking about you at all. Do what you need to do to get the care you need. And the last thing is, you go to the emergency department, you're gonna wait forever because it is window to wall with patients. If you can get the same care with less inconvenience to yourself, then do that. Schedule an appointment with your primary care provider. Schedule an appointment with your doctor's office. And if you cannot do that and you need to be seen right away, it is an emergency, then please come to the emergency room and get taken care of. So what can we do about all these things? You can protect yourself. I know you don't want to hear it. I don't even want to hear it. I don't want to consider it. I know you've put your mask away. I know you have. I see you in the grocery stores, and you know what? You see me. I only wear my masks in certain situations, okay? So wear your mask. There's still the COVID vaccine if you haven't gotten that and you want to. There's the COVID booster if you haven't gotten that and you want to. The flu shot is available if you haven't received that and you want to. And take care of yourself, know your body, recognize your signs and symptoms. But if you don't want to do any of that and you want to stay safe, you know what you can do? You can go to what we know works. Hand sanitizer, and that is a substitute for washing your hands, okay? Wash your hands. Stay away 6 feet. Social distance is still a thing. Don't be all up on people's shoulder and looking in their cart and stuff. Don't do it. I know, most people have taken their signs down, but we have realized what worked. And so if it worked in the middle of a pandemic, it'll work otherwise. So gel those hands. If you cannot wash them, stand back and away from people. Get out of my personal space. Why don't you? I didn't like that even before the pandemic. And what else? Wear your mask. Put the mask on. Just stay safe. I know you put them away. Again, because I see you and you see me. Pull them out, dust them off, get your masks, and get a supply of them, okay? So what are you going to do? You're going to seek the care you need because you know your body. You're going to seek the care at the appropriate venue or place, urgent care, primary care provider, and if neither of those are appropriate, then go to the emergency department. We're going to stay out of the emergency room if it is not an emergency, if at all possible. You're going to gel your hands and you are going to wear your mask. If y'all haven't seen that from last season, you should. Tis the season, okay? Tis the season to be contagious. Tis the season to get a cold. Tis the season to get the flu. Tis the season to get COVID. Tis the season to get RSV. And 'tis the season to be thankful too. All right, so remember, the nurse knows that you need to be safe. You need to pay extra special attention to your signs and symptoms and being safe. And you need to mask it up. So until the next time, live well, do well, be well. I'll put some more information on my social media pages about the differences between flu, COVID, and RSV so you'll know what you're watching for. And while you're watching for that, I'm going to be watching to see if you wear your mask.